This Sanofi-sponsored episode is intended for informational purposes only and should not be considered medical advice. Patients should follow up with their healthcare provider for individual and personalized guidance for managing their healthcare needs. In addition, I want to note that during the course of our discussion today, speakers will be referencing their personal and professional experiences. These experiences and views are their own, and experiences may vary. Welcome back to the Peds Doc Talk podcast. I'm your host, Dr. Mona, and this show continues to be a top parenting podcast because of you. And not only do I love it because I get to help educate and empower you through your parenting journey, I get to chat with the most amazing guests and have the coolest opportunities. Like this episode. I recorded this episode in New York City with two very special and inspiring moms and leaders. Can't wait for you to tune in to our conversation. So we are shaking things up today on the Peds Doc Talk podcast as I'm recording from Joining Beyfortus in New York City, an event hosted by Shawn Johnson East in collaboration with Sanofi, an innovative global healthcare company discovering, developing, and delivering medicines and immunizations for millions of people around the world. And Nanit, a leading provider of baby monitors and other products to help moms and dads navigate parenthood. Today, mom content creators have come together to talk parenting and baby health, make some new friends, which I saw was happening, and share some laughs. I like to think of it as kind of a sisterhood of parenthood, if you will. As part of our conversation, we will also be talking about something pretty timely, assuming you are tuning in between November and March, serious lung disease caused by respiratory syncytial virus, or RSV. We'll also be opening up the conversation to the others in the room so we can have a bit of a Q&A to leave you all leaving a little more reassured. Before we introduce our guests, I want to provide some background on RSV, a topic that for many parents only came to the forefront as a result of recent surges and the approval of immunizations to help prevent it in babies. RSV is a highly contagious virus that can lead to lung infections like bronchiolitis in babies and can be spread from kissing or even snuggling with a favorite person or a favorite toy. RSV is most common during the winter virus season, usually fall through spring, but can vary by local areas. For example, in Florida, where I practice, our RSV season typically occurs a little bit earlier, and we're actually in it right now, compared to other parts of the country. That means it is now circulating in Florida and other southern states and will soon be affecting other parts of the country. Some listeners may be newly familiar with RSV, but it has been around for a long time, and it's something I have dealt with for over a decade in my training and my clinical practice. In my experience as a pediatrician, I've seen the full variety of symptoms. Most of the time, RSV will be a mild cold-like illness, which we have talked about. And initial symptoms of RSV can include congestion, runny nose, irritability, decreased appetite, and fever, so look similar to a common virus that you may experience like any other upper respiratory virus. Symptoms which tell me that the infection has likely spread to the lungs and my patients need to go to the hospital or come see me in the office include short, shallow, and abnormally fast breathing, a wheezing cough, nasal flaring, poor feeding, unusual tiredness, developing a blue tint in their fingernails or their lips. The classic presentation of a baby or toddler with RSV lung infection includes typical viral symptoms mentioned above, but around day 3 or 4 of illness, which a lot of the stories said that, baby had it on Friday, by Sunday they were in the hospital. They start developing shortness of breath and parents will report noisy breathing, a sign that they're developing lung involvement, which we are trying to prevent. RSV is more common than you might think, and although severe RSV is uncommon, it is the leading cause of hospitalization in babies under 1, and 1 in 4 infants hospitalized with RSV are admitted to an intensive care unit. Many are surprised to hear that babies are 16 times more likely to be hospitalized with RSV than the flu, and that severe RSV can impact babies that are healthy and born full term. I think there is a common misperception that RSV is only serious for babies that are premature or have underlying medical conditions, but that is unfortunately not true. But the good news is, last year, the first and only long-acting RSV prevention administered directly to babies became more available. And we're going to hear more about that, including a first-hand experience with it later on. And as I mentioned, I'm sitting here with some extra special guests today that I couldn't be more excited to chat with. We're joined by Olympic gold medalist in gymnastics, mother to 3 kids, and parenting content creator Shawn Johnson East, who has also partnered with Sanofi to help raise awareness for RSV prevention. We're also joined by Vice President of Clinical Research at Nanit, Dr. Natalie Barnett, also a mom to 3 boys. Thank you so much for joining me today.
Thank you.
I'm so excited to chat. And the first question I have is for both of you, and I'll have Shawn go first. But before becoming a mom, how familiar were you with RSV, and had you even heard of it?
Not familiar at all. I don't think I had even heard about RSV, let alone knew how common it was and how risky it could be, but definitely got to learn it firsthand.
So when I was a new parent, I had heard of RSV but did not know much about it at all. But now today it's something that I'm very familiar with, and I know through our studies at Nanit Lab and the research that we've done how challenging it can be for parents to be dealing with any sickness. So.
Yeah, and thank you so much. I like, as a pediatrician, I just like to hear where people stand with all these things that I'm so familiar with. I'm like, this isn't new, it's been around. But it's so exciting to be here with Sanofi to talk about all of this today. Shawn, you have a personal connection to RSV. Can you tell us more about your family's experience?
Yes, so we kind of got hit multiple times. My daughter, when she was 21 months old, Drew, she got RSV, and I was pregnant with our second. Mm-hmm. It presented as just I thought it was a common cold. She handled it very well, but we had it diagnosed in the office because I was pregnant and there was a baby coming around. She got through her RSV totally fine, but it was unfortunate because of Jet. 6 months later, Jet, after he was born, got RSV, and didn't think much of it since Drew handled it just fine. I didn't go further into research and understanding how severe it could be. It was the third day. Woke up in the middle of the night hearing my baby struggling, and he had a really hard time. He couldn't catch his breath. The noisy breathing is an understatement. It was really scary. Ended up calling an ambulance for him, and he was hospitalized for almost 2 days, but made it through that well with intervention and treatment, but it was definitely a scary experience.
And I'll note that at the time your children were impacted, the 2 older, RSV prevention was only available for high-risk babies.
Yes, it wasn't even a conversation. I had full-term babies, so in my pediatrician's office and with my OBGYN, it wasn't something that got brought up.
Yeah. And for those of you wondering, Beyfortus is a prescription medicine. So we've spoken about the difference between vaccines and being a medicine or antibody, used to help prevent a serious lung disease caused by RSV in babies under 1, born during or entering their first RSV season, and certain kids up to 24 months. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus, and Beyfortus may not protect all children. Also, Beyfortus is a preventative monoclonal antibody, and I love getting nerdy and talking about what that is because it is a little bit different than a vaccine. A quick explanation on what this is and how it's different from a traditional vaccine that induces immunity. Antibodies are made naturally by our immune system to fight illnesses, especially viruses, but a baby's immune system might not be strong enough by itself to make enough antibodies to fight RSV. This is where preventative antibodies can come in. They give protection that a maturing immune system can't yet provide for itself. If your baby comes into contact with RSV, the preventative antibodies in Beyfortus stick to the surface of the virus to help prevent it from infecting the baby and causing more severe lung disease. So meanwhile, your traditional vaccine, which we're hopefully all familiar with, that your children should routinely be getting, are like self-defense instructors. So they teach the immune system to create its own antibodies versus administering them directly. So I describe it as like a self-defense instructor is teaching you how to protect yourself from future invaders. That's awesome. That's a vaccine. Whereas if you are getting cornered in an alley and Batman comes to save you, that is an antibody. They're going to not teach you anything, but they're going to protect you so that you can hopefully prevent severe lung disease. So if you like an analogy like that, there you go. So it is important to know the difference, and we like to call it a preventative medicine, immunization, and not a vaccination because it's technically not a vaccine. And I'll share full important safety information about Beyfortus at the end of this podcast, which is so important to know. And I know as moms, we would do everything in our power to support parents in helping to keep their babies healthy, and that responsibility can be stressful at times. So another question for both of you, what have you done to empower yourselves as parents or help to empower and support other parents? And I'll ask you first, Shawn.
Talked to my pediatrician way too much, so much so that he'll probably block my number soon. Truly, my pediatrician is like a lifeline.
Yeah.
He is a part of our family, and I lean on him for every single thing. When we got pregnant with our third, of course, he was due in the middle of RSV season, and we always host about 30 people at our house. 11 of those were kids under the age of 6 when he was born, and it's something that's very important to our family, and we couldn't miss. I couldn't quarantine my baby enough to protect him, so having that conversation with my pediatrician about Beyfortus was huge. We talked through all the potential side effects, such as like rash, hardness at the injection site. And for us, it made sense.
Yeah.
Having gone through that with Jet, I really just tried to arm myself with a ton of education, ask my pediatrician the questions, go through all the side effects. And for us, we ended up having Bear immunized on his first visit with our pediatrician, and he did great. And it was just a comfort as a mom knowing that was an option.
I love that.
And I want to, build on Shawn's point about, helping new parents to feel more empowered. At Nanit, we really focus on sharing information and offering products that can help support, new parents during that new baby phase. And from my own experience, that can feel, very overwhelming.
Yeah.
And as some of you are, listening to this podcast may already know, the Nanit suite of products includes really, a lot of amazing things, including our light and sound machine, as well as our, baby monitors that can really help parents navigate their baby's sleep journey. And as much as baby sleep is important, so too is parent sleep. And I remember sleep being a very big topic when I was a new mom. And I would encourage expectant and new moms to try and manage expectations about newborn sleep, but also learn about tools and tips and tricks to establishing good sleep practices over time.
And thank you both for all that you do to support parents and moms and dads as well. And Shawn, it goes without saying that I love your platform, your podcast, your social media. To be able to speak so transparently about the stories that you share is so nice because people feel less alone. I think every parent wants to do the best that they can, especially moms, and sometimes we feel guilty when our kids get sick. Sometimes we feel like we're not doing it enough. So when you have a large following and you're sharing this real life mom life, that things are good, but sometimes it's not so good. Sometimes you're going to be hospitalized. Sometimes you're going to have this happen. And sometimes your kids are not going to always do what you want. It's so refreshing. So thank you for doing that.
Thank you.
Yeah, I'm not going to make you cry, but it's really important. Yeah, thank you. You're helping the world. I mean, and I love following you for that. And Natalie, I know how nerve-wracking early parenthood can be, and I think of all the information and offerings that Nanit has to be able to support parents and help them feel more empowered, because that's literally what this is all about, right? That is so important because there's so many chapters that will happen in a parent's life. And in that first few months, especially in that first year, we're talking about, something that's going to help prevent severe lung disease in Beyfortus, but, the sleep concerns, the technology that's out there to really help support and empower parents. I really appreciate that.
Thank you. And I am a mom of 3 teenage boys now, but some of our new technology that we have developed, I just wish I could have had and was around when I was a new parent myself. But part of what I do at Nanit is I lead our research team and oversee collaborations and researchers at hospitals and universities all over the world to really help better understand pediatric sleep using the Nanit camera. And this work is done through our research program called Nanit Lab. And we really believe that the power of technology and data to help you better understand your baby's sleep. And babies thrive when their lives are consistent and they know what to expect next. And establishing good, healthy sleep habits from an early age can really help benefit them for the rest of their lives. And the insights on this can help parents make sure their baby is following a routine that works best for them and, works best for their family.
Oh, I appreciate that, because everywhere a parent will look, especially parenting in 2024, you're going to find more information and new toys and new parenting styles. Do this, do that, new medical guidance. It is overwhelming, and I'm sure people in this room can feel the same way. And it can be very stressful, the never-ending stream of opinions that people will get from grandparents or friends. And we live in a time where we are connected to the world like never before. And I think it's such a blessing. And again, I love the technology, but it also, everything's in the palm of our hands. And with that can really cause a lot of stress. And that's kind of why I started my podcast in the first place and my platform, because there is a way to parent without the noise. You got to get the information from the right places, use the products that are evidence-based, which I know Nanit is involved with, use and gravitate towards information that's adequate and informed versus misinformation. I'm so grateful to be here with Beyfortus and Sanofi, because there's evidence to what we're doing here, and same thing with what Nanit is doing. And I wanted to just break it all down and get to the bones of the issues at hand to help parents guide them through this never-ending information and decision overload, because that is what causes parents, especially my fellow moms in my office, to lose sleep. They're worrying about doing it right. And the fact of the matter is, as moms, we're all just trying to do the best that we can. And I genuinely believe this for every mom that walks through my door and every mom that attended this event today, because we want to protect them from harm and especially protect them from illness. We don't want to see our children hospitalized. And as a pediatrician, I know that sometimes it happens, but that is what we all want. And in recent years, pediatric respiratory infections have taken a front seat in a lot of our minds. I know many of us have seen the headlines about RSV, especially 2 years ago when illnesses and hospitalizations from RSV were sadly on the rise. And until last year, the only RSV protection available was for high-risk babies, or behavioral interventions like hand washing and cocooning, which is where you protect your baby away from those that might be sick. But finally, there are preventions with Beyfortus, for example, that help provide your baby with an extra layer of protection. And a single dose can give your baby 5 months of protection against serious RSV lung infection. An additional dose of Beyfortus may be needed for children up to 24 months if they are high risk, so if they're entering their second season and are high risk. And for children undergoing cardiac surgery with cardiopulmonary bypass, an additional dose of Beyfortus is recommended as soon as the child is stable after surgery. So the most important thing is always speaking to your child's clinician if you're unsure if they should get it, if they're over the age of 1. If your baby is born during RSV season, which is now fall through spring, Beyfortus should be given at birth, and all hospitals should be offering it. And if you don't want to get it there, you can get it at your pediatrician's office, and they're going to get it usually at their first doctor's visit or whenever you decide to do it, but sooner is better so that you can be protected for the season. If your baby is born in the spring or summer, your baby can get Beyfortus at a regular checkup, typically just before RSV season, and they get their injection at the same time as other routine childhood vaccinations. So no special visits, no more car seat, trying to get them in the car seat for other trips. Just do it all at one time. And as a pediatrician who knows all too well the impact of RSV and what it can have on babies, their parents and fellow providers, I feel hopeful that there's now an option recommended by the CDC, as well as the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics, and supported by a growing, incredible body of evidence. Beyfortus has also been added to the approved immunization schedule. This means that Beyfortus may be available to your baby at no cost as part of the Vaccines for Children, or VFC program. VFC is a federally funded program that provides vaccines to children at no cost for those who might not be vaccinated because of an inability to pay. I do want to note that some providers may charge an administration fee, but the goal here is to get as many babies protected so that we can prevent severe lung disease. And I hope that parents will feel encouraged by this conversation and visit Beyfortus.com as well as speak to their doctor to determine what's best for you and your family. And I did want to open up the conversation to everyone here today. And if anyone has any questions, we would love to answer those for you. What advice do you have for new parents when it comes to analysis paralysis? Sometimes it's so hard to know what the right choice is for our babies. So how would you recommend navigating that?
Look, Mona, that's a great question. And look, parents are really trying to make the right.
Yeah.
Everyone wants to make the right choice for their baby, and at Nanit we want to empower parents with the data that we're giving them. We don't want to be overwhelming them. We want them to feel empowered that they can make decisions about their baby's wellness and sleep through the data that we're providing them. Of course, we always want folks to be going to their pediatrician or their healthcare provider for any medical concerns they may have, but we really we don't want them to be feeling overwhelmed or have analysis paralysis.
Yeah.
We want to simplify all of the data that they're getting, and we try and do that every day by trying to we analyze their sleep data, their milestone data, their movement data, and are able to sort of simplify that and present that to parents in a way that they can understand and feel empowered by, not feel overwhelmed by.
I love that.
I do have to say, we're a Nanit family 3 times over.
I love it.
It's the only thing we've ever used. I was geeking out with her. I'm like, this is the greatest thing ever created for parents. I was watching my baby sleep here earlier.
Well, you showed it to me, and I was like, this is amazing. And I'm going to become a Nanit family too now, I think.
Yeah. I still use it for my 5-year-old.
I love that.
Yeah.
And then another question that had come up was for you, Shawn. What is one thing that helped you feel supported and calmer in the transition from pregnancy to parenthood?
Oh my goodness.
I know you had 3, but
yes. I would just say my community. I feel like my husband and I have tried really hard. I feel like it's a common theme through all of these. There's so much information out there that you can get really scared as a new parent about whether you're making the right choice or not. And I think something my pediatrician and my OB really reiterated to me early on when I had my first baby was this idea and this fact, I think, that you are your child's best parent, not grandma, not the internet, not your followers or commenters or anything.
Yeah.
It's truly you, and you're your best advocate for your children. And remembering, if you can remember that and keep your kind of close circle small when it comes to those decisions for you and your babies, I think that's really important because it is very specific to you and your circumstance and your family. And don't let your net get too wide because it can be really intimidating and scary. So we truly just try to lean on the people that we have in our close community.
And I can tell you do that, and it's a great piece of advice because when I have families come in that are telling me they read this and then someone's saying this, I'm like, well, who's that most trusted person? Besides me, hopefully, because I know your child's health, who is that person for you? And so I love that you guys do that because it could get so easy to listen to every single opinion, and doesn't mean that every single opinion is a good one, or they may not know what's really going on in your family, and so that's such useful advice.
Thank you. We work really hard, and I don't want to say that I haven't had massive failures where I go to Google and I'm like, what's wrong? And then I freak out and call my pediatrician in the middle of the night, and he's like, get off the internet, you're fine.
And thank you so much for your love for your pediatrician. You said it a few times, but even though I'm not your pediatrician, like to hear people talk so positively about the modern medical system and pediatricians, it's so reassuring because this is again what we're trying to do here and really support modern medicine, support the advancements in technology, in science, in evidence-based research. And so when content creators or celebrities are saying, I love my doctor's my go-to, he's not going to block your calls, okay? We really appreciate that.
Thank
I
you.
love it. Dr. Mona, when do I know I need to see my doctor if they have RSV? Or do I need to go when they just have a stuffy nose? And the answer is you do not need to go if your child has a stuffy nose, okay? The hope is that you're going to get this preventative antibody, and that is going to prevent or reduce the risk of severe lung infection. So Beyfortus is not going to reduce your chance of getting RSV, but the beauty of it is that if your child contracts it, it can really significantly reduce their chance of getting the bronchiolitis, the pneumonia. That is the thing that I'm seeing. I'm not seeing patients for a runny nose. Well, I do, but I'm more concerned of the lung involvement, the bronchiolitis, the involvement of the lower airway, the pneumonias. So if your child has a runny nose, I need you to protect your peace and not go into panic mode thinking that, oh my God, they're going to be in an ICU, it's over, I can't believe this. You're going to say, I got this. We're going to take this day by day. My kid is sick right now. I'm going to love them. I'm going to support them. And if you do see on that day 3 or 4 of illness, you start to see that difficulty breathing. So this is being recorded, but the lungs tugging, the chest tugging in and out. Your sternal notch, which is right above your right by your collarbone, tugging in and out. Your nostrils of your baby's flaring in and out. You will not miss respiratory distress. I know I have never seen a parent be unsure of respiratory distress, but if you see any of the signs, whether it's RSV or not, you're going to seek medical attention. You can call your doctor's office. If they're not open, you're just going to go to the hospital. Another thing you're going to look out for is dehydration. So your baby, your toddler, not drinking, not urinating, really sunken eyes, lips are super dry. That is another sign of medical necessity that we need to evaluate. And then your third thing is they're just off, listless. They're not your normal baby. They may have a fever, and you just can't get them consolable. You're going to want us to take a look at them so we can provide, even if it's just reassurance. And then with fever persistence, anytime a child has a fever over the age of 3 months, we would, if your child is dehydrated, difficulty breathing, we want to know. If you do have an infant under the age of 3 months or a newborn, you're going to want to let us know right away if they have a fever. But those are the big things you want to look out for. And I like to be clear about this because many times with the RSV education out there or the news stories, people hear, get a letter from their daycare, there's RSV circulating, and they look at their newborn, and then every breathing change, they think it's like they need to go to the hospital. My cousin just had a baby, and she sent me 10 videos, and I'm like, you're so lucky that I'm your cousin because I will tell you. And she's like, thank you so much. I heard about RSV. And I'm like, no, that's just normal newborn breathing. I got you. Send me another message. But I think it's really important to know what things look like. And if you're ever unsure, go to your pediatrician, make an appointment. I rather have y'all come in and we say y'all are good, go home, than you Google searching things in the middle of the night, because knowledge is power and it can give you a guidance on what do I need to look out for. I want to thank you all for joining us today. This was such an amazing conversation. Natalie and Shawn, thank you for joining me.
Thank you.
And for this really cool experience of this live podcast. So thank you for your time and for this beautiful event, Sanofi. Thank you.
It's our pleasure. Thank you.
Whether it's your first child or your fourth, having a new baby is overwhelming, especially with all of the competing opinions and information overload out there. So I truly hope that I help break down the information around RSV infection and a preventative measure that may be available to you. Since RSV season has already started in many parts of the country, don't wait to talk to your OBGYN, pediatrician, or healthcare provider about RSV prevention. You can also visit Beyfortus.com to learn more.
Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus, has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by respiratory syncytial virus, RSV, in newborns and babies under 1 year of age born during or entering their first RSV season. Children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season.